All right, let's talk about something incredibly important and, let's be honest, monumentally boring sounding ISO 2022. It sounds like the name of a forgotten droid from Star Wars, maybe C-3PO's socially awkward accountant cousin. But it's not, it's a standard. Yes, a standard. I know, your heart is racing with excitement. But stick with me. This standard is actually a very big deal. Think of it less like a rule and more like a universal language for banks and financial institutions, like the world using the same power outlets, but for sending trillions of dollars around the globe every single day. That's ISO 2022. For decades, the global financial system ran on a patchwork of old, creaky messaging systems. Imagine trying to send a text message. But first, you translate it into Morse code, then smoke signals, then interpretive dances, hoping the other person understands your jazz hands. That's basically how international payments worked. Each country, and sometimes each bank, had its own dialect. ISO 20022 is the financial world's Google Translate, but one that actually works, and doesn't turn "I need to pay this invoice" into "my uncle's hamster is a champion wrestler." So what does this language do? The key is data. Old systems were like a postcard, very limited space. You could write to Bob from Jane amount $100, and that was it. ISO 20022 is like sending an encrypted email with attachments, spreadsheets, and a detailed PDF explaining exactly what that $100 is for. It allows vastly more information with a payment. This isn't just to make bankers' lives easier. It's about creating a transparent, detailed, and incredibly rich data trail for every transaction. A game changer. The world is in the middle of a massive multi-year migration to this new standard. It's happening right now. Central banks from Europe to Australia to Canada are getting on board. It's slow, complicated, and expensive, like changing an airplane engine mid-flight. But the payoff is enormous. It promises faster payments, better compliance with anti-money laundering laws, and a foundation for future financial innovations. And crucially for today, it has a secret, powerful role in healthcare. Now let's turn to healthcare mergers. If you think your family reunion is a logistical nightmare, try merging two multi-billion-dollar hospital systems from different countries. It's an absolute circus of complexity. One company uses one set of software for billing, another for patient records, a third for paying suppliers, maybe on a 1998 computer kept in a broom closet. The other company, say in Germany, has a completely different set of systems. It's like trying to merge the New York Yankees with a professional cricket team. They both use a ball. That's about where the similarities end. The financial integration part is a special kind of hell. You have to combine payroll for thousands of employees. Across different countries with different tax laws, you need to untangle supplier contracts and payment systems denominated in different currencies. One hospital pays for its bandages in US dollars, the other in euros. How do you create a single, unified system without accounting having a complete meltdown? This process, called financial synergy, makes or breaks mergers. Sometimes they succeed spectacularly. Sometimes they fail disastrously. It's the boring, behind-the-scenes plumbing that determines if the megacorp works. Enter ISO 20022, our friend wearing a superhero cape made of spreadsheets. Because ISO 20022 is a universal standard, it provides a common ground, a Rosetta Stone for alien financial systems. Instead of spending months or even years building custom expensive software bridges, they can adopt the ISO 20022 standard. It lets them map weird, unique data fields like patient ID formats, insurance claim codes, supplier invoice numbers, into one universally understood format. The ultimate peacemaker in the war of corporate data formats. Imagine a US hospital group merging with a European pharmaceutical company. The US side faces private insurance codes, copays, deductibles. The European side deals with National Health Service reimbursements. Before ISO 20022, reconciling payments for a bulk drug order meant an army of accountants and a mountain of paperwork. With ISO 20022, the payment message can carry remittance advice, invoice details, regulatory information, making the process smoother, faster, and far less prone to human error. It's a revolution in corporate finance that just happens to be perfect for this industry. This isn't just a theoretical exercise, it's happening right now. Let's look at a real-world, albeit hypothetical example to see how this works. Imagine a large American healthcare provider, American Health Corp. Now imagine a Swiss medical device maker, Swiss MedTech. American Health Corp operates hundreds of hospitals and clinics. Each has its own legacy payment system. Swiss MedTech has a sophisticated, different international sales and supply chain system. It deals in Swiss francs, it deals in euros, it deals in dollars. Before ISO20022, the CFOs would be facing a multi-year, multi-million-dollar IT project. Enter ISO20022. The integration team decides to migrate all financial messaging to the new standard. For American Health Corp, that means upgrading their treasury management system. One hospital in Texas pays a Swiss MedTech factory in Zurich. The payment message is no longer a cryptic string of numbers. It's a rich data file. It can contain specific purchase order number, serial numbers of the medical devices being paid for, the patient case ID the device was used for, the relevant insurance reimbursement code. All of this information travels with the payment in a standardized format. On the other end, Swiss MedTech system receives the payment. It instantly knows what to do with it. The system automatically reconciles the payment against the outstanding invoice. It updates the inventory. It allocates the revenue to the correct business unit, all without a human manually looking up a purchase order or deciphering a vague reference. What used to take days of manual work and a flurry of emails between Houston and Zurich now happens in a matter of seconds. This is the promised land of corporate finance. This isn't just about efficiency, it's about visibility. Leadership now gets a real-time, crystal-clear view of cash flow. Across the entire global organization, they can see exactly which product lines are most profitable, where payments are getting stuck, how currency fluctuations impact the bottom line. Before, they were flying blind on quarterly reports that were often out of date. Now, they have a live dashboard of the company's financial health. This granular detail is invaluable in the turbulent post-merger period, helping leadership make smarter, faster decisions. So what are the actual benefits here? Who wins in this brave new world of standardized healthcare finance? Well, pretty much everyone, starting with the healthcare companies themselves. The most obvious benefit is a massive reduction in costs. By automating processes that were once manual, error-prone, labor-intensive companies can save millions on administrative overhead. Fewer accountants are needed to chase down missing invoice details. Fewer IT specialists are needed to maintain those clunky, custom-built data bridges. This frees up capital that can be reinvested into what healthcare companies are supposed to be doing: research, innovation, patient care. Hospitals and clinics on the ground also see major advantages. Imagine a hospital that has just become part of a larger international group. Thanks to ISO20022, its procurement system is now seamlessly integrated with a global supply chain. When a surgeon needs a specific high-tech surgical implant for an operation tomorrow, the system can automatically place the order, process the payment, track the shipment in real time. This reduces the risk of delays. It minimizes the need for large, expensive inventories of medical supplies. And it ensures doctors have the tools they need right when they need them. But what about patients? This all sounds like back-office corporate jargon. How does it help someone waiting in the emergency room? The link is indirect, but it's powerful. When healthcare systems are more financially efficient, they are more stable. A hospital that isn't wasting money on administrative chaos can afford to invest in the latest MRI machine hire. More nurses reduce waiting times. Enhanced data in ISO 20022 can lead to more accurate billing. Fewer errors in processing insurance claims means fewer surprise bills and disputes for patients. A smoother financial process contributes to a smoother patient experience. Finally, let's consider the broader health ecosystem. For health companies, the rich data flowing through ISO 20022 channels creates incredible opportunities for analytics. By analyzing anonymized payment data, you could identify trends in disease prevalence, track the effectiveness of treatments across different populations, optimize the supply chain to respond to public health crises more quickly. The payment system becomes more than a way to move money. It becomes a source of strategic intelligence. This drives better decision-making for the company for public health as a whole, all while maintaining strict patient privacy. Of course, this all sounds a little too good to be true, doesn't it? A magical standard that solves all our problems. As you might expect, there is a catch. Or, more accurately, several catches. The biggest hurdle is the sheer cost and complexity of implementation. Migrating an entire company's, let alone two merged companies, financial infrastructure to a new standard is a monumental undertaking.